Good afternoon, everyone. My name is Elaine Cruikshanks. I'm a partner at Acumen Public Affairs, and it's my privilege to moderate today's discussion on behalf of our co-hosts today, Organon, and the European Parliamentary Forum for Sexual and Reproductive Rights. If you were in any doubt at all about the topicality of our subject today, which is learning lessons from COVID-19 for women's health and well-being, one only needs to look at today's newspapers. For instance, from The Guardian today, there's a deep dive into why women are more likely to suffer from long COVID. While men over 50 tend to suffer the most acute symptoms of coronavirus, women who get long COVID outnumber men by as much as 4-to-1. It was observed in a study in New York that around 66% of patients have been women. A lot of them were in full-time jobs, have young children, and now more than a quarter of them are completely unable to work because they're so unwell. Economically, it's a bit of a disaster. And this is not a new trend when it comes to infectious diseases, rather one which has historically been neglected. In general, there's not much research, money, attention on conditions that primarily affect women. That's just a general disparity in medical research. And some academics have speculated, as they do in that article, that there are certain biases that persist, that when women present with a lot of body aches or pains, there's more often an emotional or personality component to it than medical origin. So says one of the academics from New York. But I think this little story actually underlines exactly why we're here today. Although gender equality and women's empowerment are very high on the EU's political agenda and have been for some time, for instance, I note there is currently the third edition of the EU Gender Action Plan, which calls itself an ambitious agenda for gender equality and women's empowerment in the EU external action. There is a commissioner, indeed, Ms. Dalli, responsible for gender issues and women's rights, and there's also a parliamentary committee, the FAM committee, one of whose members will be joining us today, Ms. Rafaela Samira. From that committee, which has done some very good work, which I hope we'll also discuss today. However, the outbreak of COVID-19 has caused setbacks to gender equality. There is also ample evidence that the COVID-19 pandemic has disproportionately affected women's lives. Across every sphere, from health to the economy, security, social protection, the impacts of COVID-19 are exacerbated simply because of the fact that it's affecting women. So the other aspect I just wanted to draw attention to as we open up is the fact that in the next 2 months, the European Commission will carefully assess whether member states implement the requirement that measures in national plans for recovery and resilience fund take gender dimension into account of COVID-19 in its plans. This presents an opportunity to overcome some of the dramatic impacts of the COVID-19 pandemic on gender equality. So in today's seminar, we hope to provide some information on the gender dimension, underline why gender equality is a necessity, and to highlight the policy and recommendations for the recovery period to take account of gender-specific issues. But before I dive in, I'd like to hand over to our co-host, Nico van Heuke, who's President of Europe and Canada for Organon, and he's overseeing the women health business of Organon. And in this position as president, Nico ensures that countries in that region are well equipped and able to offer patients and customers and governments Organon's range of products. So over to you, Nico.
Thank you, Eileen. And also thank you everyone for being with us today. It is really my honor and privilege to welcome you to this meeting, and thank you for freeing up time to participate to this meeting. Some of you might wonder on why are we as a company, Organon, co-hosting this event with the European Parliamentary Forum. And actually the answer is pretty simple. So exactly 2 weeks ago, we were in New York, not personally, right, but our ELT was in New York to ring the bell. So we have founded a new women healthcare company. And the company has one single vision, and the vision is to make a healthier and better day for every single woman. We want to put women in the center of everything we do. It will be a challenge, I admit, but we really want to listen and understand the true unmet health needs. So we believe that a lot has been done already in the past, but that more can be done. And as Elaine was describing, the impact of COVID is big, so the time is now. So we do believe that as a company, you cannot do it alone, right? And a lot of stakeholders are here on the line. So we do believe that collaboration will be key. And I'm absolutely looking forward to listen and to work together with stakeholders across all sectors to raise the awareness on what the health needs are for women. So today is actually only a first indication of our commitment, as we are co-hosting this event with the European Parliamentary Forum. And I'm absolutely looking forward to hear what our panel of experts have to say about the COVID impact, what COVID had as impact to women from all different kind of aspects, right? So as an outcome, I hope that we can continue to identify these policy recommendations and opportunities so that we can truly address the needs of women. Thank you, Elaine, and I'm handing it back to you. Okay.
Thank you very much, Nico, for that introduction, and welcome indeed on behalf of Organon and EPF. Just before I hand over to the next speaker, I'd like to just cover a couple of housekeeping issues. First of all, this session is being recorded, so that you're aware. And more importantly, in terms of your participation, to submit questions, which we hope you will, attendees should write them in the Q&A box. Please note that attendees will be muted during this webinar. Questions from the audiences will then be reviewed, and as many as possible we'll put forward to the panel, who I'll introduce in a minute. But before we get to that, I'd like to introduce, to give us some more context to our discussion, Ms. Bathylle Missika, who's head of the Networks, Partnerships and Gender Division of the OECD Development Center. And she'll give us a presentation focused on the socio-economic impact of COVID-19 on gender equality. Can I hand over to you, Bathylle, and welcome.
Thank you so much, Elaine and Nico, for the opportunity to be with you today and for the kind introduction. So what I'm going to talk to you about now is how the COVID-19 again has affected women's health and well-being. So first, a few points on our research on how the COVID-19 pandemic has specifically affected women's health and overall well-being. Second, as you may have seen already, this is not a very gender-friendly recovery that we're witnessing around the world. And finally, so what can we do collectively about it? So to begin, some facts and some thoughts. So where do I come from? I oversee a team in the OECD that is in charge of a project called the SIGI, the Social Institution and Gender Index. And what this does, it looks at discrimination in 180 countries in the world for women and girls based on laws and social norms. So in some ways, this is everything you cannot see. If you see that there is a gender pay gap, maybe it's because the world's population or men think that women should stay at home. So we look at legal ways and ways in which society makes it very hard for women to achieve the same opportunities and equality as men. So from that perspective, I will share with you a few thoughts. So it may not have escaped you that this crisis constitutes a major setback to advance gender equality and women's rights worldwide. I will take 3 specific examples on women's health, on women's economic empowerment, and on women's leadership. So first, how has the COVID crisis affected women's health? Well, beyond the virus itself, there have been consequences in terms of gender-based violence which has been triggered by the lockdowns, by sometimes the frustration of men that may have lost their jobs and end up being stuck at home as well. So even before the pandemic, 1 in 3 women in OECD countries experience physical and or sexual violence at least once in her lifetime. And while we do not have precise figures yet, because a lot of this data is difficult to obtain, we're in the process of collecting it, the incidence of this violence has increased. So as I said, lockdowns and the interruption of services make it difficult for women to leave home, to leave their abusers. So that's been one of the reasons for this. And again, the destabilizing effect on routines and roles within the household can provoke also violent reactions from men. On the economic side, the pandemic has had very detrimental effects on women's employment. Women have lost their jobs much more than men have. Why is that? Because they constituted the majority of the workforce in the sectors hardest hit by border closures and lockdowns, such as the hospitality business, tourism. Women were also more likely to be employed in informal jobs, selling goods on markets, or to have low quality jobs. So not only did they come from a less well-off position in the job market, but they ended up worse off. Some of the explanatory factors go back to social norms. What we call sectoral segregation is driven by gender norms. So the fact that women tend to work in certain sectors, because those sectors are seen as acceptable by society, by both men and women. In a similar fashion, you will not find a lot of women in STEM, including pursuing PhDs, because this is seen as more of a male, career track. So that's been very detrimental economically for women. Another social norm that has gained increased attention is unpaid care work. So all the work that women do to take care of their children, of the elderly, of the household. So this burden of unpaid care work has gone up tremendously. Even before COVID-19, women spent 3 times as much time on unpaid care and domestic work as their male peers. Now there is more of that, more demand on that care work, because when you have kids out of school, you're supposed to also help them with homework. If you have sick relatives, sick with COVID, you are the one as a woman expected to take care of them. So that limits the time you can spend on productive employment, on pursuing education. So this has had, again, very dire economic consequences. Last and not least, on the leadership front, women are still largely excluded from decision-making processes. This will not come as a surprise. I'm sure if you saw the family photo of the G7, I mean, yeah, there were 2 women, but it's a panel of men. I mean, this is the reality. And this also stems from some social norms. So in the healthcare sector, women make up for nearly 70% of the workforce. 85% of nurses and midwives are women, but in senior management in healthcare, women are a minority. Well, again, because people feel that these positions of leadership, should go to men, should be held by men. So in 2020, we observed that in G20 countries, 1 in 4 people on average reported saying that they think that men make better political leaders than women. And 47% reported that they share this belief. So you can imagine, in times of crisis, people feel even more conservative and feeling that the decisions, important decisions, should be in the hand of serious men. That kind of relegates women into the home. And this is accepted even by women themselves sometimes. They feel it's their duty. So that's had very serious consequences, including on leadership. We do see that this is a major cost for the economy. This is not just a moral issue. This is what we have been arguing time and again. We're not coming up telling, we work with the G20. telling G20 leaders that they should care because it's a moral issue. We're not even getting into values. It makes economic sense. The loss for GDP, world GDP, even before the crisis, if we eliminated these discriminations of norms and laws, it would have been the equivalent of 7.5% of world GDP. So that's $6 trillion US. So again, this is the case that the scene does not look so good, and women have paid and are still paying a very high price. Now, it doesn't get much better with what I'm going to present now, which is the international recovery agenda, the international response to COVID is not a gender-friendly one. So in these circles, in very, in specialized circles, in circles where we've worked on the issues, we all agree. But open your newspapers and see, do the headlines talk about gender? A lot of these ministers of finance that are in charge in our respective countries, they are worried about points of GDP, shares of market. They are not super, the gender lens doesn't penetrate their discourse. So that building back better does not include women. And this is a bit of I find it a scary figure. From our analysis in G20 countries, out of 600 national policy measures taken by G20 governments so far in response to COVID-19, only 240 of them were gender sensitive. So that's 38% of all measures. And sometimes they're also quite marginal. So women's health and well-being are largely overlooked in the context of COVID-19. So the health agenda focuses on issues that we're not saying are not important, like universal health care. However, taking women's specific health needs, including maternal health, reproductive autonomy, or securing access to family planning is critical. And it's critical not just because of values and rights, it's also critical economically. Unfortunately, in developing countries that have limited healthcare capacities, a lot of resources are diverted now towards the fight on COVID. So what does it mean? If you're pregnant in a developing country, already you might live in a rural area very far from a hospital. Your needs are very unlikely to be taken into account. And this will limit also the chances that you will have a safe delivery of your baby, because you don't feel that you should be going to the hospital. You might risk or fear getting COVID there. And also maybe all the resources from that, the health sector in your country have been redirected to fighting COVID. So that requires a policy response that, again, we feel is lagging a little bit. So what can we do? Because hopefully there are many things that we can do to change that. So we've identified 3 areas based on our work that we feel are very important. First and foremost, invest in more and better data. I know that sounds maybe nerdy. It doesn't sound like, addressing the needs of frontline workers and of people closest to the disease, but believe me, this is, we can't do without. Why? First of all, to know the effect of a certain phenomenon on women and men, you need to have gender disaggregated data to capture the different effects of COVID in different dimensions. So that's already not the case in many countries. Countries themselves do not monitor the different, the gendered impacts of COVID. We also need to capture time use. So this is how we calculate the unpaid care work burden. This takes a lot of work. It's expensive, but it's necessary. We will not know in what ways policies can reduce this unpaid care work unless we measure it. So again, data from that perspective is going to be critical, and we keep making that point. So we also have to collect more data on norms, on what people find acceptable. Because in the G20, the main measure that people know on data is what is called the Brisbane target. The Brisbane target looks at the gap between how many women are employed versus men. So the employment, overall employment, what is the gap? And they aim to reduce that gap by 25% by 2025. However, if you do not look, if you do not see by measuring it that men think that in times of crisis, men should be in charge, you can increase all the opportunities for training that you want. If society believes, including women, that they should stay home, this is a major issue. So second, naturally, social norms are critical, and because they're a hidden part of the iceberg. We're not talking about, inequalities the way we can witness them. We're talking about the causes of inequality. So something we've started to do is to look closer at masculine norms. So basically, what we all believe, men and women, that dictate what real men should do. Real men should be decision makers over household decisions, for example. That men are the ones who should be earning an income. So in the EU, in EU countries, 43% of respondents agreed that the most important role of a man is to earn money. And so this means that real men are breadwinners, and this promotes the devaluation of women's paid and unpaid labor. So I will repeat, because I think this is pretty striking. We're not talking about some, remote area. We're not talking about developing countries. We're talking about EU countries. EU countries, 43% of respondents think that the most important role of a man is to earn money. I'm sorry, I find that quite shocking. And in an environment where what gets measured gets addressed, we do need to get this data, because that's the only way we can push the envelope further on women's health and well-being, as well as for gender equality in general. And then this is one of my last points. The private sector has a huge role to play. They have a responsibility to apply a gender lens on company policies, on their business models. So of course, this can be incentivized by public policy. In France, we had the Pénicaud Index. So we have to report, companies have to report gender representation or pay across companies. But companies themselves can also promote this more actively, promote greater parity. So in sectors where women are underrepresented, this has become really, really critical. And many companies have taken a very active and firm stance on this. So I would say in sum, there is a role to be played at different levels, at our individual level, being mindful of it. At the company level, the company has a societal role to play. At the public policy level, naturally. And when we vote, we vote, we elect members of parliament. And what kind of society do we want to live in? Who do we want to represent us? So I will stop here, and thank you very much for your attention. And I look forward to the following discussions in the panel. Thank you very much.
Well, thank you very much, Bathylle. That was really interesting, and some stunning figures that I noted. The GDP figure was a stunning one in terms of numbers, $6 trillion US dollars, what one could do with that, eh? But also some of the horrible, more personal figures about 1 in 3 women experiencing domestic violence and sexual violence, even before COVID. And with lockdowns, I assume we will find out that things probably have got worse in that respect. And I also particularly like the fact that you came up with solutions. Perhaps we can come back to these later as we go through the panel, especially this issue that comes up everywhere these days about data and collecting data, the holy grail, as it were. In the meantime, I look forward to you joining the panel. I'm going to now introduce our panel to you now. So I'll introduce everybody, and then I'll go back to a more general question. Perhaps people can be thinking about what they took out of Bathylle's very interesting remarks, because I'll come back and ask each of you or offer you the opportunity to contribute what you've taken out of that and what your experience is in terms of impacts of COVID on women and what you've already noticed in that respect. So maybe I can start with a member of the European Parliament, Samira Rafaela, who's a Renew Europe member from the Netherlands. Welcome, Samira. And she's basically been in the Parliament since 2019. And she's one of its youngest MEPs, so congratulations. And as a member of the FAM, the Women's Committee, she's been very outspoken on women's rights and reproductive rights. For instance, she's been shadow rapporteur for the gender perspective on COVID-19 crisis and post-crisis period. I should just remark that the MEP has a very busy schedule, so we need to make the most of her presence here because she'll be gone about 5 o'clock. If I can now introduce the second member of the panel, that's Miss Peggy Mcguire. Welcome. She's Director General of the European Institute of Women's Health, and she's worked at EU and national levels highlighting the need for gender equality and gender equity in biomedical, public health and social policy in Europe. And in 2020, amongst many other things she's done, she actually co-wrote a briefing document on the impact of COVID-19 pandemic on women and their families. And she's recently appointed by the Irish Minister of Health to co-chair the Women's Task Force and lead on developing a women's health strategy. So welcome, Peggy. And then next, I'd like to introduce Neil Datta, who's Secretary for the European Parliamentary Forum for Sexual and Reproductive Rights. And he is one of our co-hosts today, along with Organon. So welcome, Neil. He founded the EPF, which is committed to that issue of sexual and reproductive rights and protecting the world's most vulnerable people, both at home and overseas. And then another member of our panel is Katrina Graham. She's Policy and Campaigns Officer for the European Women's Lobby. And she's based here in Brussels, like some of the rest of us. And she worked within the broader policy and campaigns team coordinating the work of the organization in combating sexual exploitation. And she works to promote intersectional values, including promoting migrant women's rights and girls' rights as well. And then last but not least, I'd like to introduce Susanna Fiedler, who's Chief Commercial Officer of Organon. And as CCO, she's responsible for driving the company's business strategy and achieving its vision of a healthier every day for every woman around the world. So welcome all. We have some gender balance in that we have Neil here, but I'm pleased to see so many bright and women joining us today for this discussion. I wanted to come back to what has already been raised by Bathylle in relation to the OECD's research. And I wanted to, if you could share your perspective on the challenges that Ms. Missika has put forward as regards the impact on women from your own perspective as an organization. And I think I'll pick on Neil basically as the only man present as the first respondent. Go ahead, Neil, give us your views.
Thank you, Elaine, and also thank you, Bathylle, for a very insightful opening introduction into this subject. I think we've all been looking at COVID and the impact of COVID on our specific areas, and I think hearing from you, Bathylle, it's made me realize that I've been perhaps in a little silo in my own world of sexual reproductive health and rights, and I haven't realized the broader implications on other aspects of gender and women's lives of COVID. So thank you very much for that. Maybe I'd just like to focus a little bit on my own little silo of sexual reproductive health and rights and how COVID has impacted in this area. And I based this on a survey that we did together with the IPPF European Network, that's the International Planned Parenthood Federation, just over a year ago. We were hearing anecdotal things from different countries at national level about different impacts of COVID. And so we thought we would do a survey and see what does that mean. And what we found was that there were 5 areas where sexual and reproductive health and rights was being directly impacted by the onset of the pandemic and also the related lockdowns that accompanied the pandemic. So one area was contraception. So what we saw is that women across Europe were reporting increased difficulty in accessing contraception. Simply from, in some cases you need a prescription, you were not able to get that renewed, or in some cases with injectable contraception, women were not able to get a doctor's appointment to either have it inserted or removed. Another area that we saw was abortion. In many countries, there's a consultation which is obligatory in order to access abortion services. During the first wave of lockdowns, a lot of medical staff refused to engage with face-to-face non-essential medical services, and this included sometimes consultations on abortion. What we saw also was compromised medical care in terms of maternal health, so that, for example, because of fear of certain doctors and medical staff, they limited access to the theater of the fathers of the spouses of the women giving birth. Another area that we saw compromised was also fertility treatments, where there was an interruption in the program of fertility treatments. Now, all of these, contraception, abortion, maternal health, and fertility, they affect primarily women, and also they have the specific nature of being very time sensitive, so that if you don't get access to the service at a specific time, then that compromises the health and the rights of the women. And maybe a fifth area I just want to point out is that in some countries, those countries which we know have been sliding into illiberal authoritarianism, we saw very cynical approaches by certain governments to use the lockdown in order to further limit women's rights. So that during this period, we saw increased restrictions on abortion and on the rights of sexual minorities in certain countries. These were unnecessary during this time, but they still happened, and they happened in part because of the limitations on the freedom of assembly, so that people against them were not able to organize protests to fight back against these limitations. So we saw these 5 impacts on sexual and reproductive health and rights: abortion, contraception, fertility treatments, maternity care, and also freedom, women's rights overall being compromised.
Thank you, Neil. That was very, very interesting, and again, more data for us to absorb. I wonder if I can turn over the floor to our member of the European Parliament, Samira Rafaela, who perhaps can give us a political view from the European Parliament's point of view, because I am aware that you in particular, but also the European Parliament, has been doing a lot of very interesting work in relation to the impacts of COVID on women. So over to you to give us some of your views, please. Thank you.
Yes, thank you very much. And it's so good that we keep speaking about it, because indeed we could see that the crisis, the pandemic, had a major effect on women and girls in our society, and therefore also children. I think that we can come to the conclusion that this inequality, this injustice was already there, but the pandemic definitely helped to make it more clear and more explicit. So I remember that the very first weeks that I was very busy with as being the FEM coordinator for my group Renew Europe was the rise of violence against women at home, domestic violence. And we have learned from the pandemic that confinement measures have detrimental consequences for the prevalence of gender-based violence. And then we immediately come to the very important point on including women in decision-making, and definitely in crisis decision-making, because I believe that also we could have closed a gap there in decision-making if we would have more women in general in Europe engaged in decision-making. So we could see that emergency calls reporting domestic violence in the European Union have increased by 60%. And it is for this reason that it is very problematic that the response to this crisis is led by male-dominated administration. So this is one very important thing that we need to take from this pandemic. And most governments have failed. Also, we seek to apply a gender lens and have been very slow to respond to the specific challenges faced by women. So I remember that a couple of female MEPs needed to send letters to the European Commission, asking the European Commission to reach out to member states to please hurry up with extra measures to protect women, girls, and children from violence. And of 115 national dedicated COVID-19 task forces in 87 countries, 85% were made up mainly of men, and 11.4% comprise mainly women, and only 3.5% have gender parity. So I think I made my point now. And the lack of women in decision-making roles during the pandemic has contributed to this response that really lacks a gender-sensitive approach. And this is why early in the debate already in the European Parliament, we have asked for gender mainstreaming of our budget, for gender mainstreaming of all the protocols and the solutions for this pandemic. And we could also see that very few member states adopted a comprehensive national policy or action plan addressing potential surges of domestic violence. But it's really good that the European Commission accepted our push and also proposed themselves to have gender impact analysis and gender impact assessments so that we can evaluate and monitor very soon, hopefully, what the very first results are. So we definitely need a European Union protocol on violence against women to prevent gender-based violence and to support victims during emergencies such as the COVID-19 pandemic, because unfortunately, we know that this will not be the last emergency situation we need to deal with as being Europe. And this protocol must include very essential protection services for victims, such as shelters and safe accommodation options for victims, helplines and online support platforms, and guaranteed access to health services. And when it comes to SRHR, we could really see that this pandemic had a very negative effect on that. Not to forget, of course, the situation on abortion in Poland, where we needed to work on and where we also needed to protest against that this is really harming the individual situation and the fundamental rights of women. So we could also see that some governments in the EU misused the pandemic to put through legislation and new policies that further harm the fundamental rights of women and girls. And I am very glad with the work of Neil Data and many more in Europe that are so keen and so proactive when it comes to fighting for this cause, when it comes to the protection of fundamental rights of women. Then we come to the point of online violence. What applies for physical violence is also important for online violence, we can see. So there are a few statistics available that indicate how big the problem of online violence is. We do know, however, that increased domestic violence against women witnessed during the crisis is spilling into the online space, turning the lifeline of the internet into a hostile space. This is a very, I believe, new development that we are dealing with. And I'm very glad that more and more attention is given to violence in the online spheres because there is a lot to gain. And the new European Digital Services Act can really prove to be, a good instrument that also obliges large social media platforms to step up their efforts in removing illegal content. Then the last point that I would like to make as a response to the introduction, that is equal representation, because it goes without saying that we also need to focus on economic empowerment within the European Union, so increasing the economic position of women and thereby also stimulating financial independency, because it can have an influence of the overall well-being of women. And we do see a relationship between the financial, the economic independence and, for example, violence against women. So it's very important that we keep working on the economic independence of women. And I assume that we all agree that no one's work should be valued also lower based on their gender. So the current gender pay gap in the EU stands now at 14%, leaving, of course, plenty of room for improvement, especially as economic indicators suggest that these gaps are further widening because of the pandemic. And with the new proposal for a directive on pay transparency, the European Commission stresses that equal pay for equal work between women and men is a guiding principle within the EU, and that we should act accordingly. So we will start the negotiations on this proposal very soon, because if we want to close the gender pay gap, it also means we have to step up our efforts to achieve equal representation at the highest level of decision making. The profession with the largest differences in hourly earnings in the EU were managers. So we see 23% lower earnings for women than for men, and less than 10% of top companies, CEOs in the EU are women. So that also means that, for example, the Women on Boards Directive is very necessary to rebalance these historical imbalances that became bigger also because of the pandemic, and that put an end to the glass ceiling for once and for all. So also within our own institutions and external action, equal representation should be the norm rather than the exception, and the pandemic made it very clear why it's very necessary to work on that. Thank you.
Thank you very much. In order that we can get in some questions, etc., I'm sorry for the two ladies, but could we have your opening remarks or opening reactions, and then we can come back and get some more of your inputs as we go through. Shall I start with you, Peggy, with what's your take on what you've heard so far?
Thank you very much, Elaine, and thank you, Bathylle, Samira, and Neil, for your inputs. And I think Bathylle has set the scene, and it resonates. Everything she says has resonated, and really emphasises the fact that health is a biological and also a social factor as well. So there are a lot of influences outside the health sector that affect somebody's health. I think that COVID has exacerbated and highlighted existing inequalities and inequities for women's health. I mean, as the previous speakers have pointed out, people who have had issues around accessing contraception, I think there was something like 9.8 million women globally would encounter family planning issues, access to fertility. This is a huge issue. And also the surge in domestic violence, particularly affecting women and children. And also the responses to the pandemic, including the isolation, had implications for mental health, and also the surge of domestic violence, which have a gender response moving forward now post-COVID. I think Bathylle made some very interesting comments about the whole issue of the economics of the situation and GDP. But health inequalities result in an economic loss of about 980 billion per year. And if we could address gender equality, we'd have a bigger impact than, say, labour market and education policies. This is the reality of the situation. Looking at the whole disaggregated data issue, I mean, historically, women have not been included in clinical trials. And that's a huge issue for women. So we have drugs that are generalized and applied to women that have not been tested on them, generally tested on men. So this is a huge issue moving forward, that we have to look at that, this huge inequality. Now, there is a great emphasis now on the new regulation, the new clinical trial regulation, which has sex and age and gender included in it. So this is really a positive influence for women's health. So in future, women and older people, for example, will have to be included in clinical trials. So, that offsets that issue around getting a bit of balance in clinical trials. But we have to make sure that any analysis that is done on results have to be done and disaggregated by age and sex and gender. Otherwise, we cannot have proper targeted policies in relation to women. Also, women are on the front line and have been on the front line of caring, both in a professional capacity. We have over 76% of women on the front line during COVID, and also women as carers. And we have an awful lot of older women who are also carers, who have had opportunity costs, who are suffering from extreme anxiety and stress because they are looking after family members. So therefore, it's a life course approach. I think just to move forward into what we're going to talk about next, when we're talking about the response to COVID and having a gender response to COVID, we must have a life course approach to women's health, looking at it for opportunities within that life course of where we can intervene and improve women's equality. Also, looking at, we have had 25 years of Beijing, we've had, I think, 67 years now of the Treaty of Rome, and we also have the UN development goals, and we still have huge discrimination against women, and inequalities are still existing. So where do we go from here? What do we have to do to make sure that current legislation, current policies that promote equality in health are actually implemented at national level? This is a huge issue for women moving forward. And also, what we think in the European Institute of Women's Health, what is needed is a national strategy, at national level, strategies for women's health, so that we can fill the gap in relation to inequalities. Another huge issue, apart from looking at disaggregated data, is the whole education of healthcare professionals. There's a lack of understanding of the differences in how diseases manifest and progress in women and men. And I think it's necessary now that moving forward, we have to have specific educational tools for healthcare professionals that can reduce the lack of awareness, the lack of information among healthcare professionals at undergraduate level in curricula development, and also postgraduate at continuing medical education, so that women can be listened to, be taken seriously, and given the proper treatment that they need. At the moment, you have a lot of women, and particularly during our strategic approach to women's health in Ireland, where we've had a radical listening exercise with women. Women are not listened to, and they must be listened to moving forward if we are to have proper policies for women. I'll leave it at that at the moment.
Thank you, Peggy. And before I turn to Susanna to get a perspective, perhaps from a more business point of view, can I just pass the word to Katrina, who I don't want to be too pushy, but if you could actually just give me a few opening remarks at this stage, otherwise I think we will get to question 2. Thank you.
No problem at all. Very happy to contribute. So really from the European Women's Lobby's perspective, our analysis around the impact of COVID-19 comes from a membership-based report that we actually had already completed and launched in April of last year. This report was compiled going to our more than 2,000 member organizations, all working on women's rights across Europe, asking them to highlight to us what they were already identifying as some of the key issues that women and girls were facing within their countries, that organizations were facing, healthcare professionals were facing. What could we do about it? And from there, we came up with a number of solutions and recommendations. Some of the key areas that we looked at as part of this report were around gender mainstreaming in responses, looking at democratic principles, combating male violence against women, realizing a feminist economy of care, and making sure that we had a strong and equal health system. So really from that, we could see that there were quite a few similarities across East and West and North and South divides, but there were some various successes and some real challenges. So perhaps in the West, we were more likely to see progress towards more equal access to contraceptives, to abortion access, to reproductive health care, a little bit less of a tendency to limiting access to these support services, more recognition of these as emergency healthcare needs. Whereas then towards the East, in a few countries, we saw a little bit more of a tendency to use this opportunity to really limit healthcare support services. I would absolutely agree around the analysis of the need to support and recognise women as being at the front line of healthcare supports and the regression to women's role in society as part of COVID-19. For example, we know that in Germany, more than 75% of hospital staff are women. So it's a highly gendered phenomenon, and we really need to recognise the value of women's work in our society in a way that we haven't to date. So here I would echo some of what Samira Rafaela was mentioning around pay transparency. And as part of that directive and that piece of work going forward, we would really say that we need to look at what is work of equal value when we say equal pay for work of equal value. And we need to have a cross-sectoral analysis of that. So you're not only comparing like within a sector, but you're also recognizing that the care sector is just as valuable as other areas that are more highly economically valuable at the moment in our society. In terms of the challenges that we've seen around women's role in society, we know that already pre-existing the pandemic, there was already a time gap of 34% between women and men, a care gap of 30% between women and men. So real differences to the kinds of time available to women to live their lives. And this has only worsened in the pandemic, where we know that women took up the key burden of home healthcare supports, of home education supports, etc. So we've seen a huge increase in different challenges, and I think I'm really looking forward to discussing some of the opportunities for recommendations going forward. Thank
you so much, Katrina. And I'm actually stunned by the wealth of information that people are bringing forward. It's quite amazing. So maybe I can turn to you in that regard, Susanna, because it's a very new company that you have. But I think it's pledged, and what Nika was telling us, that you're pledged to listen to women and provide opportunities for them. I just wondered, since your launch a couple of weeks ago, what you've heard in that regard.
Yeah, so I think what's really important, the decision to spin off Organon from MSD and to create a new company has been taken prior to COVID. And already at that point in time, we saw the strong need to support women in their healthcare. That's why we decided to create a company dedicated to women's health. And as we've heard from other speakers, COVID has highlighted and amplified the needs of women in general, and also when it comes to healthcare. So I think it's very important to listen. And I really appreciate and want to thank the OECD, the European Parliament, and the European Commission for collecting these very important facts, because only when we know the facts, we know what we deal with, and also we can then find solutions together how to address the needs. So I just when we prepared for the launch of Organon, we gathered the voices of women around the world. So we collected 500 contributions of women and asked them about their needs in healthcare. And there were some really common themes. For example, that healthcare needs vary greatly as women age, and the need to really healthcare education to recognize that and to address that. And another theme was really the desire of women to discuss and destigmatize topics such as menopause, then also the need for more focus on preventive healthcare. And most importantly, women want to be listened to, and they want their health concerns and challenges taken seriously and addressed.
I'm on mute. I did the classic mistake. Thank you for that input. That's really helpful. Actually, I wanted now to go back to one of the areas that was raised by Katrina, which was basically, I think, the disparities even within the EU in terms of East-West. And a question actually by a colleague of yours, which was particularly interesting, perhaps I can direct it towards Bathylle, is how do you view the differences in women's post-COVID health needs between high-income regions like Benelux and lower income areas of the European Union? So I don't know, Bathylle, if you've got some views on that, and certainly Katrina and Neil maybe have some views on that in terms of the disparities of the impacts, and the others please chip in as you will.
Sure. I mean, this is a really good question. The main difference between, let's put it, OECD countries and countries that have weak capacities will be first that you do not mean in terms of policies. Policies will necessarily be more likely to address gender needs, I would say, in OECD countries. Social norms are going to make a big difference, because depending on where you live and how people feel, they might go back to more traditional views. But going back to policies and existing infrastructure, if you get sick in the Benelux country, you can go to a hospital. The hospital might be very heavily tilted towards the fight against COVID, but you might still be able to get access to a doctor, to contraception, even if, as rightly said by Neil and other panelists, this might be made more difficult because a lot of these unfortunate circumstances have been used against, to kind of push women back even further into their traditional roles, negating their rights. So I think what will make a big difference now is, first of all, we don't all countries do not start from the same place. And what worries me, we've been having a dialogue with a lot of countries, and we're currently doing so in 3 sub-regions in Africa, is that people tend to confuse norms with culture, the acceptability of culture. They say, you have to understand our norms and you have to respect them. And I mean, I'm sorry, but in what culture is it acceptable to beat your wife, sometimes to death? I'm sorry, there's no culture can justify that. And we're not trying to apply like a wide framework on, that one size fits all. The norms that we're looking at and the laws are the ones that derive from international conventions, from European laws, from international treaties, and these countries have signed up to them. So again, do not mistake culture, what is accepted and what people should respect and follow with basic human rights. So I would say the difference will be in policies, in capacity, and again, in the collectively held beliefs, which are so hard to make evolve. Thank you.
Thank you. Just before I turn to Neil, I just wanted to bring in again Ms. Rafaela, because I know she's got to go in a few minutes. And maybe you have a perspective about Petra Willem's question from Organon about this disparity between East-West inside the European Union. What is it the European Parliament should do, could do, to actually help the European Union address these disparities of access to healthcare for women?
Yes, I definitely recognize what is being said about that, and I think our responsibility is really that we act as the European Parliament. That in the end we act as the European Union together, in which we indeed call upon these basic norms and these basic values indeed. And I totally agree that we should not misuse culture for justifying indeed, for example, violence against women. And I think this is really our duty to incorporate these basic values, the values that we share, into the policies and the legislation that we make. So I hope that this can be our added value by having these debates here internally, and at the end to find a majority for very important resolutions, for very important legislation and directives that at the end all the EU countries need to work with, because this is the most that is very strengthful, I believe, if we manage to get a majority, for example, a resolution on the situation on abortion in Poland, or if we get a majority for pay transparency, or if we get a majority for a resolution on violence against women, this is when we can get also the other EU countries where we see bigger problems to commit then. And I think what we already tried to do by making sure that all the countries, all the EU countries commit to it is, for example, through gender budgeting. So making sure that all the EU's budget are gender mainstreamed, and that we also aggregate data also on the EU level, and that we also work on protocols that are broadly accepted and supported. So this is a way with which we can commit all the EU countries to it, and keep repeating what our values are. If you are a member of the European Union, then you need to respect women's rights, and there is not any culture, not any religion, not any ideology that justifies violence against women.
That's very helpful. I mean, one of the things I understand, despite all the activities of the European Parliament, is that there isn't really a structure at the moment at EU level for member states to sit around the table and compare notes on this inside the council.
One comment that I can make on that is that my group, Renew Europe, we really fought really hard for this gender equality council that is indeed that will be incorporated in the council, where a Secretary of States, but also ministers of the different member states can come together and to discuss specifically gender equality and women's rights and the state of gender equality in the member states, where they can also discuss files that are being blocked now in the council, like, for example, women on boards, but also the issue we're having now, the big problem we're having now on the Istanbul Convention. So I believe that such structure can really help to have that structure and to commit member states.
That's really helpful. Thank you so much. And I think we're just coming up to 5. So I wanted to make sure we had the best of your input during the period you had available to us. So thank you very much for taking.
I apologize so much for leaving you, but thank you very much for this very interesting debate, and we'll definitely speak to each other soon.
Thank you. So maybe I can now turn back to the rest of the panel. Neil, did you have any thoughts on that East-West disparity? And perhaps Katrina, who mentioned it first, or indeed Peggy?
Yeah, thank you for that, Elaine. I just recall about a year ago, or a bit more than a year ago, when COVID first happened, people were calling it the great equalizer, that everyone is in the same boat in COVID. We're all under the same lockdown restrictions and all that. I think now with hindsight, we realize it was not at all the great equalizer. Some of us were in it. We were in the deluge of COVID. Some of us had a yacht. Some of us had a rickety little raft, and some of us didn't have anything at all. And when you take a look at how, who it is that had what, we see that COVID disproportionate or affected different categories of the population very differently, based on socioeconomic strata, based on race also in certain countries, and also based on gender. And so I think that's important to keep in mind. And when we take a look specifically at those areas of sexual reproductive health and rights, which are often a proxy for women's rights overall in many countries, what struck me is how fragile the whole normative construct of women's rights were in even very progressive countries. And that the result that stems from the fact that many of the rights that women think that they have are very outdated norms. So that in many countries, the right to abortion is predicated on a woman going through certain obstacles. Now, a woman can go through these obstacles relatively easily under normal times, but you bring in the COVID, you bring in the lockdown, you bring in limited access to medical professionals, and then what should be a right becomes very, very much limited. And I think what we're seeing now is that what this revealed is the outdated nature of many of these norms. And then you combine that with the cultural soup that Bathylle mentioned, which makes it into very genuine obstacles. But one thing that we did learn is that in countries where there is the political will expressed like Samira, Rafaela, or many other parliamentarians or governments to overcome these outdated norms, then there were solutions found. From Ireland, the United Kingdom, Belgium, and France, there were telemedicine solutions that were found for consultations and things like this, or changes in medical procedures in Italy to make certain services accessible. So really, where there's a will, there's a way. But in many other countries, there was not the will. And that poses a challenge. Thank you.
Thank you. Katrina and/or Peggy, do you have anything? If you don't, we can move on, but no?
I think Neil did a very strong summary there, so I would really agree with everything that he mentioned. I think one of the other things that really came through from our membership as a concern was in relation to democratic principles. So ensuring that democratic principles were respected, that freedoms were maintained. And I think this was maybe one of the other dimensions where there was a slight divide in the East and West, where we really saw that there was much firmer commitments to timelines in some of the Western European countries compared to the Eastern European countries, and across Europe more as a whole, we saw in some of the more authoritarian leaning countries, there was a slightly slower progress towards reintroducing freedoms and or a higher level of restrictions and more police state type attitudes to those restrictions. So I think that's another element that we can really highlight. But I think I would echo what Samira had mentioned in terms of really the solutions need to be European solutions. So whether we have a divide that is east-west, north-south, we still have pockets within all of these countries. We can't point to the West and say it's a beacon of solutions and modernity in every single case. There are absolutely pockets and issues on different issues in different locations. So we saw a widespread range of issues and solutions brought in by the countries. So what we really need is best practice sharing modalities. So again, this council formation for ministries for gender equality within the Council of Europe would be really important. We know that sports ministries, I believe they meet 3 times a year, and yet there's 0 council formations for women's rights. So that's a really important thing to bring together best practice examples for solutions to really share and bring this forward. We need to have the directive on violence against women and girls brought in at the European level. We need to see increased engagement around health supports, around telemedicine and SRHR, access to contraceptives that's free, making sure that it's accessible to all women, making sure migrant women aren't left behind, making sure that no matter your legal status, you have free and equal access to health supports. I think there's so many different provisions that we need to make sure that we bring in as a whole of Europe. Thanks.
Fantastic, thank you. I don't know if you had anything to add, Peggy. if not, we can move forward, because I think we've touched upon this already, and I think that list given again by Katrina is very interesting. But maybe before we get to what could be the solutions at EU level versus national level, maybe I could just ask again, Susie, from a business perspective, what do you think as a representative of a company on women's, focusing on women's healthcare? What are the areas you're planning to focus on particularly to make a difference in this area?
So when it comes to gender equity, I think it is very obvious that as a company focused on women's health, we need to do everything we can to ensure that also internally. And as we just heard, this is a conscious effort. You cannot just say this is our intention and that then it will happen. You have to track it, take conscious decisions. We're very proud that our board of directors consists 70% of females. But we also know that other levels, areas in the organization, we're not at parity where we would like to be, and we have actions in plan to achieve that over time. With regards to our vision to become a leader or just to be dedicated to women's health, truly, we really put women in the center of everything we're doing, and we go beyond reproductive health, and we look at diseases and conditions that are unique to women and those that disproportionately impact women and are a heavy burden on them. And then we also want to go broader than medicines, but also look into diagnostics, devices, technology solutions. And when it comes to conditions specific for women, I just want to give you a few points of unmet medical need, which is really critical for us to address. If you think about the share of unintended pregnancies worldwide, that's 45%. And this is all, has nothing to do with COVID, it's pre-COVID. Then 10 million women suffer from severe peri or postmenopausal symptoms, which are very often untreated. And women are told that this is such a normal part of their life and a natural condition for them. 26 million women suffer from uterine fibroids, and less than 20% are diagnosed and treated. And out of 10 premenopausal women suffers from endometriosis, and not even half of them are diagnosed and treated. So these are just a few facts of conditions specific to women where you have high unmet medical need. And with COVID and everything we just discussed and learned about the facts, the need to listen to women and their healthcare needs is even becoming bigger.
Thank you for that, Susie. I think that, Bathylle, you had something to interject. Whilst you do that, perhaps I can tack on something. You mentioned data, and it's been mentioned quite a few times during the discussion, and it is a subject there. Digital data is going to solve our lives, apparently. So I just wondered, since OECD is a great source of data, where you think the focus should be, and what do you need from people like national governments to actually contribute? Have you got the mechanisms set up to get the right data, and what will you have to do that? And one example of an OECD report that I'm aware of is Health at a Glance, which apparently used to have disaggregated data for women in it every year, but doesn't anymore. So I was just wondering if that's something that the OECD might be thinking about going forward.
Okay, so because I came here with the intention of speaking freely, so I will continue and tell you that no matter how much we think data is important, people don't find it important at all. They love to say it's important. So we have the SIGI, so this tool I mentioned, which I believe is a global public good. And it is at the risk of dying because it is not funded, because everybody loves to use it, talk about it, but we just are missing funding. So what do we need? Well, we wouldn't need to have it if governments collected this data themselves.
Yeah.
There is a responsibility, as many companies can collect their own data and have it gender disaggregated, but governments should be doing the same. However, they don't. And when it comes to gender norms, they do so even less. It's costly, it's complicated, fine. But so yes, we do need more of this data. And actually, we're going to put forth a collective commitment for the Generation Equality Forum. So the OECD is part of Action Coalition on economic justice and rights. And we want to make a call for more and better gender norms data, because unless you understand what is behind these figures, why are women more discriminated against? How are they spending more time in the home? You cannot fix the problem. It's more than meets the eye. So we really need to understand the root causes. Otherwise, this is fast and this is quick and dirty. What I wanted to mention too is that beyond what Katrina mentioned on gender ministries, sports and youth ministries, what we've been trying to do also as we engage with specific countries, we sometimes do a SIGI country study. So we help the government develop their own capacity to collect this data and to hold a dialogue around that with local stakeholders. So this is a long process. But when we are at the time when we need to discuss it with them, I'm not going to lie to you, there's very little interest most of the time, because gender is not part of the 10 priorities, especially now. So what I would like to do, my crusade, is I want to get finance ministers interested. I want to get health ministers interested, because it is in their interest too. You can do a package. So imagine women are the majority in the tourism sector, and they've lost their job because there's no more traveling. So you go to the tourism or in economy minister, and you say, you are going to spend, 50 million on a recovery package. Why don't you tilt it with the same amount? You allow these women, you give them vouchers for social protection to get their kids taken care of while they can resume work, while they can go get their physical, their OBGYN exams. You can't do that on video. You need to free time and get out of the house. So I would like to get these guys interested. So we've tried to find in which we would do that. So I would say, I don't want to minimize, the rights approach, but I think sometimes we need to put the economic angle to the forefront, because this is what will make sense to these guys. Half of the, how do people, this is basic economics, labor and capital. Labor is the world, it's the population, it's half women, half men. So if you're half of your population, you're neglecting, they're not employed, they're not trained, that is a massive loss for the economy, besides any rights consideration. So I think we also need to change the discourse a little bit, because I'm telling you, we found very little airtime with a lot of these, I'm sorry to say, older male that govern us. And then when we go to West Africa, it's exactly the same. However, I'll just give you this, I think it's a very telling anecdote. We're working with Côte d'Ivoire, and they are obsessed with their investment in education. They realize they also need more girls into secondary school. These girls and women are in charge of a lot of the cocoa value chain. They grow cocoa, right? They want to climb up the value chain. So we came and we said, oh, what if we did this, gender study? And they're like, oh, yeah. And then we came back and said, we've actually found a way to look at how gender norms affect educational outcomes. We could have done it with health. So we're going to prove through data that as long as girls are married at 14 and you turn a blind eye, although it's forbidden, it's done a lot in rural communities, they will not go to school. You can build all the schools you want. So you're demonstrating that it is also in their interest. And at the end of the day, I don't care if, the minister in charge doesn't become a feminist. What I care about is to see the lives of these women change and their opportunities to grow. And I want them to have access to a bank account, to contraception. So this is what matters at the end of the day. So I would say that's a plea for also, let's widen the conversation beyond the silo, because we're not making much progress here. And so I was very pleased to see Organon being created. We're about to welcome Organon into our network of multinationals that work in emerging markets. And that is an absolute treat, because the world of M&Es is still dominated also by men, and let's face it. So we need to introduce these very important points, and data will remain at the center of it, because what we can't measure, we can't address properly.
Fantastic. Not only is health wealth, but women's health is even more wealth, is what we're hearing here. And I'm sure that organ, is very pleased to be part of your organization and push that forward. So I know that Neil has an important appointment, which is his COVID vaccine. So what I wanted to do is don't forget the issue of data, because I think that's a very important thing. But I just wanted to have your views as a panel, and I'll come to you, Peggy, after Neil, just to warn you it's coming, about if you were Women's Commissioner for the day, if you were Miss Daly for the day, what is the top priority policy that you would actually action on that day? So Neil, over to you.
Okay, thank you. Very, very shortly, very quickly. If I were commissioner for just one day, I would take a look at all of the good practices that have come out over the past year about how governments have been able to adapt better to women's rights and health as a result of the COVID, telemedicine and all of this, and really make a push for those to be made permanent. And if I can do that in one day, I would be very, very happy. Thank you.
Fantastic. Thanks, Neil, for your contribution as well. And good luck with the COVID vaccine.
Thank you.
Over to Peggy.
Well, as Commissioner for the day, I would like to set up a council of European members who would specifically be looking at gender in health. And for that, I would put a budget against that as well, so that it would be taken seriously. And also, I would also have the voice of women on that council as well, to ensure that we heard the voice of women and what her unmet needs were across the lifespan.
Fantastic. Thank you. Very succinct as well. So if I can pass to Katrina.
Thanks very much. So I'm going to cheat because I've already mentioned the Directive on Violence Against Women and Girls. So I've already made the pitch for that one. But I think actually one of the really crucial pieces that we've already mentioned is internal structures, internal representation. So if we're having our Directive on Violence Against Women and Girls, which is going to be comprehensive, it's going to include provisions as far as possible on SRHR, challenging obstetric violence, making sure that women's health is reflected as far as is possible at the EU level. I think then I would look internally within the European Commission structures. I would make sure that women's voices are heard within the structures, that women are present at all levels of leadership. I would follow President Ursula von der Leyen's lead in making sure that there is gender parity across the board within our spaces, and really fight to make sure that we have adequate policies, as I think all companies should do, such as a code of conduct that includes provisions around combating and prevention of violence against women, that looks at having policies on, for example, menstrual care, on menopause care, really making sure that the Commission is at the forefront in leading on internal policies to reflect the needs of women and girls, and to highlight and show that all companies should be able to do this, all workplaces should be able to do this.
Fantastic. Thank you very much for that. So if I can turn to Bathylle and then lastly to Susie before we wrap up. Bathylle. You've made a fantastic manifesto, so don't feel you have to add, but you are the commissioner for one day. You've got to choose something. What's your priority?
No, I mean, I would also prioritize violence against women, because it has really exploded from what we've seen, and I don't think we're finished seeing the end of it. So I think we need to take a very strong stance. This includes working with the perpetrators. It's not just on the women's side. So I would also set up, a commission to look into the best practice to work with perpetrators, to see how we can also, get them to become, I would say, better citizens, but maybe that's not the right term. In any case, our social contracts, relies on that, on our ability to work together. So we're not going to get rid of perpetrators, so we might as well work with them.
Thank you so much for that. And then Susie, perhaps you've heard a lot today, as we all have, very interesting information.
Very
so
interesting.
I wonder, from an organic point of view, from a business point of view, what do you feel you can contribute going forward to this, to making a difference here?
Well, we certainly have to make sure we continue to listen to the voices of women, because women have raised their voices, but they have not always been heard. So that's an effort we need to do on a continuous basis. And yeah, as I mentioned before, we need to also make sure that we bring our vision to focus on women to life also internally, and make sure that women are included in the decision-making process. We have the right gender parity in all areas and levels, and ensure engagement of our own female employees, and maybe go broader than gender as we always try to do, really establish diversity more and more, because there's never an end. You can do much more there. And that has an economic benefit. I think that's an important point.
I think that's a key takeaway. I think what one finds in politics is that there needs to be enlightened self-interest in human activity. And I think that would be very compelling. And I know it's a big thing in all health areas, is to try and draw in the ministries of finance. But the figures were so stunning. I think it's well worth this campaigning group to really push forward with that in mind. I'd like to thank all of you for a very interesting discussion today. I've certainly learned lots and lots. I've got lots of facts and figures I've written down. More importantly, I think from perspective, I know this debate has been going on, but now is the time to strike, because lots of resilience plans with 800 billion being available in the EU and being distributed over the next few months. Now is the time to make sure that diversity and gender aspect is actually taken account of in that spending programs. And I know you're very focused on that as stakeholders, very knowledgeable about the issue. To actually close proceedings, I'd like to hand back to Nico on behalf of Organon as one of our co-hosts, just to give us his last thoughts about today and moving forward as Organon. Thank you.
Thank you, Aline. So, wow, from my perspective, I'm a little bit speechless. Because this was extremely insightful. So thank you, Samira. Of course, Samira left, sorry. Thank you, Peggy, Bathylle, Katrina, Susie, of course, Neil also left. And also you, Elaine, for hosting it. I think it was absolutely outstanding. And as we said, far above expectations. So I wrote down at least 30 pages, right? I had the privilege in being able to write down a lot of notes. So definitely I would like to follow up on a number of topics that were discussed. And what I learned is indeed a need to work together on this. The timing is now. And yes, there's progress made, but I do believe in all humbleness, there's not enough. So I do believe that as Organon, as I said in the beginning, we are committed to listen, to understand, to try to understand, right? And then to try to find solutions. So we cannot do it alone. And what I heard today is that definitely we can, if we work together with the right stakeholders, I think we can make a difference. And this is why we have actually founded this company 2 weeks ago. So a special thank you to the European Parliamentary Forum for having enabled us to co-host this event. I know Neil is gone, but I really would like to thank him. And also thank you to everybody again for attending and for freeing time up for this very, very important topic. We as Organon, we are truly committed to do anything we can to make a better and healthier every day for every woman. And with that, I would like to give it back to you, Elaine. Thank you.
Thank you, Nico. And thanks from my part to this wonderful panel, Bathylle, Peggy, Katrina, and Susanna, who are still here, but also to Rafaela, Samira, and Neil Datta as being co-hosts as well. I think it's been a very good start of the dialogue. It will continue, but I think now is the time, as everybody is saying. So let's push forward and hope to talk to you again on similar issues and to see progress achieved. So wishing you with that a good end of the day and a good end of the week. And thanks very much for participating. Good evening.